So sometimes you are ordering different lenses and the fitting is not optimal and you are not understanding how to move forward, because probably the scleral shape is has different or toricity, significant toricity or asymmetry. But if you don't have the CSP to understand how much toricity you have, it will be challenging, because you will be ordering different lenses without without resolving the case that you have, especially if you have significant toricity, like in these cases. So how the CSP can help you? By checking the toricity that you have. In this case, you can see that at a large ring you had about 900 microns, which is challenging to cover with standard contact lenses. So by changing the ring diameter, you can see at what maximum toricity you can get, that your lens that you are working with can cover this toricity. So in this case, in this this eye, you can see how much toricity we have, the difference between the two main meridians, which was 900 at a larger ring cord. But going to the ring diameter of 15, you can see how the toricity reduced, and now it's about 600, which is easily managed with any standard contact lenses. And this will help you in understanding. Before ordering any lens, it tells you what lens diameter you need to select for this patient, to getting to the final lens very fast. We have another case where we have high toricity, 720 microns at 17.3. Again, here by reducing the core to 16.5, we have 590 microns. So 700 is difficult to manage. 570 microns is easier to manage. This will give you an idea that large lenses, probably in this case, are not the best one. Reducing the diameter to 16.5, you will get to the final lens in a few lens orders, and it will allow you to be efficient in your fitting process. Now you can have the opposite situation where your sclera is spherical, but you need to add some front surface toricity. So how to understand where, if your sclera at a certain point has enough toricity to add a back surface toricity, so the lens is stable on the eye. At this point, you can add the front surface toricity. So in this case, we saw that at 15 millimeter, we had very low toricity, which the lens will be rotating, will not be stable. By increasing the ring diameter, you can see here now we have about 150 microns, which is enough for a lens to be stabilized on the eye. So in this case, if you want to apply any customization to the lens and you need a rotationally stable lens, the lens diameter should not be less than 16 millimeter. So you can see how it gives you a lot of information, not only on the lens design, but also the lens diameter, getting to your final lens easy with these patients. We will see another patients with low scleral toricity, 15.5 millimeter. We only have 64 microns. Now, increasing the ring diameter, you can see that we need to increase a lot, up to 17.4. You have around 140 microns. So this is enough toricity for the lens to be stabilized on the eye.